Is there any common age that you see, like certain cancer that we see more, like for example, if you take in terms of men, the prostate cancer is usually elderly, testicle cancer is younger. But how about cervical cancer? Is it more, or it can be any? The spectrum is quite broad.
Okay. So thank you, Dr. Miza, because I need to highlight this to the audience. Because if you talk about cancer, most of them think that, oh, I'm still young to get a cancer. So we mentioned before that cervical cancer is due to the social activity. The early exposure of sexual intercourse can actually predispose you to have an earlier cancer arising. So for example, if we have HPV infection, high risk HPV infection, it takes about 7 to 10 years for the infection to develop more clearly and transform into cancer. So in cervical cancer, it's not surprisingly that we can see that most of the cancer age group is reproductive age group. That's why the oncofertility come in, because during the reproductive age group, at least 28 to 45 years old, this is when the cervical cancer is being detected. So once they detect the cervical cancer, they will keep thinking they are still not completed family. Some of them still not married. Some of them still pursue with study and they're not thinking to have a children yet, but yet they need to go for the primary cancer treatment. That's why, if you ask me, is it a broad spectrum of the age? No, it's more on the reproductive age group, at least 25 to 45 years old.
Okay, all right.
It's not a cancer of elderly, so
Okay.
you need to know that.